Meditation or medication? When our body betrays us and we start passing through some certain illness, it may seem as though there is no way other to fight back except through medication. What if there is another way? In this video, we will look at meditation versus medication. Anxiety. Meditation can be used alone or as a supplement to medication. Research shows that meditation reduces anxiety symptoms better than, or as well as, benzodiazepine, which is an anxiety medication. People consider meditation as a better alternative because most anxiety medications do cause addiction and physical dependence. This makes meditation a better way to deal with anxiety for those who don't want to depend on medication. Sleep disorder. Good quality sleep is important for stress reduction, cognition, healthy eating, and weight loss. If you're having a hard time sleeping, you should consider meditation. Inflammatory disorder. People who suffer from inflammatory disorders like rheumatoid arthritis, muscular lower back pain, and fibromyalgia suffer from lots of pains that can hinder them from doing their day-to-day activities without discomfort. If you're suffering from any of these, you should consider practicing meditation to supplement your medication. Depression. Meditation can be just as effective as antidepressants, especially with people who relapse into depression after being on medication for a long while. Research shows that people who are trying to maintain their remissions do not rely on antidepressants. Instead, they substitute medication for meditation. Stress reduction. Stress can affect our health negatively, so managing our stress is important. Instead of taking medications to bring down your stress level, take some time to rest your mind through meditation. Overall, research shows that meditation is beneficial to human health and can reduce the symptoms of insomnia, stress, depression, weight gain, and inflammatory disorder. That just about wraps things up. Thanks for watching. Please like the video and subscribe to the channel.